If serious illness or injury left you unable to communicate, do you know what kind of medical treatment you desire? Does your family know? Your doctor? David Murray is Executive Director for the Advanced Care Planning Coalition of Eastern Virginia. Josh Parker handles outreach at Williamsburg Community Chapel, and both are involved with an initiative called As You Wish, launched on November 1st. And this particular initiative addresses the whole idea of planning for that time when you may not be able to tell people how you want your medical treatment to go. And if you can't, then people are going to have to guess, or they're going to be going through a very agonizing situation of making decisions. So this coalition was brought about because of a need, and there are a lot of groups involved in making this happen.
The coalition was created by 4 health systems who then teamed up with 4 area agencies on aging to get the message out in the community. The health systems do a great job of addressing this within the medical community, but the awareness of what advanced care planning is and what an advanced directive is really not known in the community at large, and really should be known when you're 18 years of age or older. Because if an accident occurs and you are left in a state where you cannot communicate, your wishes are paramount, but your wishes need to be documented in order for them to be honored. And the advanced directive is the document that does that. Okay.
I imagine that with advanced care directives, just the sound of it can be rather intimidating, and people might think that it's fraught with a lot of legal terminology and big decisions and meetings. And it doesn't have to be that way, but it certainly requires you to take it seriously and treat it as what it is, which is a very serious document that affects a lot of people, including yourself.
Well, it's a legal document, and it's a medical issue, but it's a human decision. Yes. And that's something that we all share independently, but as humankind. And the having that control and having the dignity of having your wishes honored really can't be left up to anyone guessing. The physicians want to know what the instructions are, what the family members know. The family members need to know because you as an individual have taken the responsibility to take the time to ask yourself, how do I want to be treated with end-of-life care? Right. And once that is done and once that is documented, you have the peace of mind of knowing that your wishes will be honored. The family members have the peace of mind of knowing that your wishes were fulfilled. And the doctors do a better job of delivering the health care you need at a very critical time without an extended period of time in crisis management, as family members might try to decide what is best for you when you're not communicating.
Right, and that happens so often. It's frightening to think about. In doing the outreach with Williamsburg Community Chapel, I'm sure you've connected with a lot of people who are probably now cognizant of the fact that this is a very important step to take, but they put it off.
Yeah, well, I think that's also a great aspect with As You Wish Virginia, is that it helps to simplify the process for people so that something that can feel overwhelming doesn't need to feel overwhelming. And I was also telling David, it reminded me of a verse that said, let us not love in words or in speech, but in action and in truth. And I think that it really demonstrates our care for our loved ones so that in the moment they're able to be emotionally present. And I think that it also, you know, as a chaplain, we'll talk about complicated grief, and I think that it can also show our love for our loved ones and our family members even beyond our death, and that it helps to keep their grief from being more complicated because of adding an undue stress, burden, trying to discern what our wishes may be, and actually supports people on honoring your wish in that time.
That's a very noble cause, and the idea of making something like this easier or more accessible or manageable early when it needs to be done is what this coalition hopes to promote, the value of making that decision at a time when you may not normally be thinking about those things, but knowing that it's taken care of. It's a fight because we're so caught up in the moment often that we don't see ahead and plan ahead, but it can take a tremendous toll on people if they're faced with that crisis decision. What is it that the coalition has provided that will ease some of the
Well, through the As You Wish program, we did create a website
Okay.
where the advance directive is readily available and downloadable. There are frequently asked questions about completing an advance directive, and then there's guidance that we can also offer, because you have really three options now. You can have this conducted with your doctor, perhaps, but if you're out in the community and want some time in the environment that you would prefer to do this in, it may be at the kitchen table.
Okay.
You can see a lawyer, but an advance directive doesn't cost anything. And it is not as complicated as one might think without having read it, but there's guidance that I think is left up to the individual that they could benefit from. And so we will help identify anyone who's looking for additional guidance to have a guide walk them through what they're reading and have them reflect and answer the questions and facilitate that personal decision, which is theirs alone.
There are some steps that you can take too that we can put up on the screen for people who might want to just get started with this. And there is the website, as you mentioned, which is up on the screen, As You Wish Virginia, spelled out, .org.
Spell it out.
Choose your healthcare agents. Now it's a plural, agents. That means there may be more than one person. That could be your doctor, your family member. Who is that?
No, there's a conflict of interest there if you have your doctor. So you want a family member that you can trust, who can be there, but more importantly, who knows your wishes because you have shared them with them. A lot of people name a healthcare agent family member who have no idea when they get to the hospital that they are the ones that now have to start making decisions. So you have to share that information and engage them in the conversation about what your wishes are, and make sure that they can emotionally represent you, even though they may not also agree with what you want. But they can represent you and honor your wishes. So you need that healthcare agent and a backup in that regard. 2 witnesses for the document. Then you share it with your primary care physician.
Okay.
And ask them to share it in your electronic health record.
Okay,
which is most important.
Right, and a lot of these things have been evolving over the past few years. A lot's changed,
has.
you know, and so that'll keep you on top of how to communicate this as far as the technical end. But when it comes to the real human aspect of it, it is talking, communicating with those people that you care about and who care about you, about something that may not be comfortable to talk about, but is so very important. I know you couldn't stress that more.
Exactly, yeah, and I think that that's the pastoral aspect. And really what's so great about this being a collaborative effort is there are so many aspects to this. And I think pastorally, of being able to listen to people, sometimes people, their anxiety, their hesitation. I think about coming to grips, really acceptance with our mortality, maybe dealing with the complexity of family relationships and who, you know, someone would want to be able to honor their wishes in that moment. And so I think that we're able to really provide a great support pastorally for what's a wonderful collaborative community effort.
Okay. Well, thank you both for joining us and letting us know a little about As You Wish Virginia. It's a great concept, a good initiative for end-of-life planning, regardless of your age. So keep that in mind and go to the website and get started. And if you have questions, there's a number to call, and you can get guidance along the way, just as long as you start taking action instead of just thinking, oh, maybe one day, because that one day may be today. Thanks for joining us.
Thank you,
Jan.
Well, still to come on the forum, the gift that keeps on giving. Stay with us.